Medical examiners who do autopsies, what's the most disturbing body you've dissected? Story 1. I worked as an anatomical pathology technician. Basically, my job is to carry out the external examination of a patient and then eviscerate them, ready for the pathologist to dissect the organs and determine a cause of death. When I was a trainee, it was a sort of rite of passage for you to eviscerate the decomposed bodies. I always used to make my first incision and then leave the body to gas off, which literally made your eyes burn. It smelt that bad, but ultimately when it came to eviscerating the body itself, it seemed to make it not smell as bad once the gases had all been expelled. Maggoty bodies are generally the worst, because the maggots literally get everywhere. Dozens of times I could feel them crawling up my sleeves and inside my scrubs. As you can imagine, you see some really disturbing stuff in the profession. But one that will always stick with me is a 13-year-old girl I had to autopsy, who had jumped from a bridge due to online bullying and had been in the water for about 3 weeks. I remember her coming in, being partly skeletal, sopping wet and covered in mud. I couldn't help but feel an overwhelming sadness as I looked at her because of how young she was, and that she had taken her own life due to bullying. I will never forget looking at her few strands of long brown hair that were left on the remaining parts of her scalp. Anyways, before we can carry out the autopsy, she needed to be undressed. Her jeans were full of sand and mud, so I had to carefully cut these off of her and hose her down as I went along. As I was pulling off her jeans, some of her muscle on the lower part of her leg was still clung to the bone, and as I pulled the jeans over it, it made her toes and foot starting twitching and moving. I had to stop what I was doing and take 5 minutes outside, not because it scared me, but it all just seemed to hit me in that moment. Story 2. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy, the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his ~70s apparently came into the ER and had chest pain, then died shortly after. Dies of a heart attack, but also had cancer. In less natural circumstances, though. Saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown-out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck and into the chest. That was pretty wild. Story 3. I may be late to the party, but I finally have a good story to tell. In medical school, my group's cadaver was an 80-plus-year-old female who was extremely unfit. Morbidly obese with muscles half the size of any other cadavers. Her pectoral muscles were paper-thin, to get some reference. We figured she was bedridden during her last few months, which would somewhat explain these findings. When we started our neurology unit and began to dissect the infratemporal fossa, I discovered a small metal pellet under the skin behind her right ear. My tankmates and I went on to find dozens of these metal pellets strewn around her head's anatomy, with some lodged into the cranium and others in the bones of her face. We contacted her living relatives to get some clarification, and they ended up revealing that when this lady and her brother were children, they said she was 8 years old, they were playing with an old decorative rifle that the family had mounted above the fireplace. Long story short, the brother accidentally discharged the rifle into the girl's face. The aftermath was this lady was blind and wheelchair-bound for the rest of her life, and the pellets weren't all removed. It was an interested dissection with that information from then on, but a sobering moment in reminding our class that our cadavers are humans with their own struggles and rich lives. If you're considering donating your body to science, please know that we don't take the responsibility lightly, and a million thanks aren't enough. I have more stories if anyone is curious. Edit. I should add that her granddaughter made a point of saying this lady did not hold a grudge on her brother, and they lived full lives on happy terms. Story 4. Performing an autopsy on an elderly patient with cardiac valve disease and found a 3 centimeters white plastic disc lodged in the ostium of one of the renal arteries. It was identical to the disc of the patient's tilting valve type mechanical aortic valve, which was in place, intact, and functioning normally. We had no explanation for why an extra valve disc was present far downstream from the heart. An in-depth review of the patient's surgical history revealed that many years prior, during the installation of the patient's aortic valve, the cage for the valve broke while being installed, and the disc had flown into the aorta and couldn't be retrieved. The surgeon immediately removed the broken cage, replaced the entire apparatus with another replacement valve, and completed the surgery. We found no evidence that there was any subsequent investigation to determine the whereabouts of the lost valve component. So for years, apparently unknown to most of his caretakers and even potentially to the patient had a cardiac valve disc lodged in his renal artery ostium in such a way that it was non-obstructing and stable, and it was discovered as an incidental finding at the patient's autopsy. Story 5. I worked as an anatomical pathology technician. Basically, my job is to carry out the external examination of a patient and then eviscerate them, ready for the pathologists to dissect the organs and determine a cause of death. When I was a trainee, it was a sort of rite of passage for you to eviscerate the decomposed bodies. I always used to make my first incision and then leave the body to gas off, which literally made your eyes burn. It smelt that bad. But ultimately, when it came to eviscerating the body itself, it seemed to make it not smell as bad once the gases had all been expelled. Maggoty bodies are generally the worst because the maggots literally get everywhere. Dozens of times I could feel them crawling up my sleeves and inside my scrubs. As you can imagine, you see some really disturbing stuff in the profession. But one that will always stick with me is a 13-year-old girl I had to autopsy, who had jumped from a bridge due to online bullying and had been in the water for about 3 weeks. I remember her coming in, being partly skeletal, sopping wet and covered in mud. I couldn't help but feel an overwhelming sadness as I looked at her because of how young she was and that she had taken her own life due to bullying. I will never forget looking at her few strands of long brown hair that were left on the remaining parts of her scalp. Anyways, before we can carry out the autopsy, she needed to be undressed. Her jeans were full of sand and mud, so I had to carefully cut these off of her and hose her down as I went along. As I was pulling off her jeans, some of her muscle on the lower part of her leg was still clung to the bone, and as I pulled the jeans over it, it made her toes and foot starting twitching and moving. I had to stop what I was doing and take 5 minutes outside. Not because it scared me, but it all just seemed to hit me in that moment. Story 6. Oh boy, my time to shine. I worked as a forensic technician/medical examiner's assistant for roughly 2 years. We were cross-trained in both autopsy and decedent removal from death scenes. I wouldn't particularly say anything was creepy per se, but some things were definitely gross and morbid. Going down to the satellite office in the south that was in the woods at 3 a.m. in the middle of a storm was certainly unsettling. However, I'll do my best to synopsize some of the most disturbing things I've encountered, in no particular order. The man who used woman's underwear inappropriately. 2 brothers lived in a would-be condemned house, both severely intellectually challenged. One more than the other. The living situation was extremely repulsive. Black mold everywhere, ceiling caving in, everything covered in crumbling drywall and water damage. Ironically, they had no running water. The only clean items were 2 pallets of baked beans and Coca-Cola. They mostly ate beans and drank Coke by the pallet. Upstairs we found the deceased brother lodged between the bed and the wall. All over the floor were woman's underwear, each heavily soiled. The house was filled with hundreds of old, unusable items. The ATF had to clear the scene. The autopsy was unremarkable. The man whose face was severely damaged by a wild animal. A man riding his bike through a field tragically died, and his face was severely damaged by a wild animal overnight. Some musculature and one eye remained, but lips and cheeks were heavily affected. A small swarm of yellow jackets had infested the face. We had to treat the body carefully to prevent insects from entering the morgue. Tragic death via bridge incident. A man tragically died after jumping from a bridge while tethered to a high-tension wire. Woman who passed away approximately 8 months pregnant. The autopsy was complex. The medical examiner removed the amniotic sac intact, allowing us to observe the baby. Extremely sad and heartbreaking, but contextually interesting. Man who passed away from an experimental drug in dental school. A dental student tragically died from an overdose of an experimental drug, resulting in a significant emergency response. Story 7. I had an anatomy dissection course last year where we studied anatomy by dissecting a donor throughout the year. Nothing really creepy happened. But the day we started working on the brain was a shocker for a lot of us. I think we all were sort of shocked that we were holding someone's entire being in our hands. I wasn't really that queasy, but that day I had to take a step outside and take it all in. It was an incredible opportunity, and I feel so honored to have been able to learn that way. Sorry, didn't really answer the question, just had to share. Story 8. I did an autopsy of a young kid around 10 years old who had hydrocephalus and was although quadriplegic yet retained some of his normal functions, like talking and understanding, albeit minimally. When I opened his skull, there was no brain. I was shocked. This was my first time witnessing something like this, but there was approx 1.5 L of fluid, and just an empty skull. The brain was so severely atrophied, it was tinier than a golf ball. Amazing how he survived till 10. Story 9. I'm a funeral director and was embalming an older woman who had recently passed away, about an hour before. I couldn't get any proper drainage at first, even though the drain tube was in her vein. When I opened it, the embalming fluid was pushing through unexpectedly. During the embalming procedure, there was an unusual obstruction in the vein that had to be carefully removed with forceps. It was about 7 inches long and had branches from the smaller vessels. Blood began to flow unexpectedly, but the embalming went smoothly after that. Story 10. I am a pre-med student, and one time while shadowing a forensic pathologist 3 days before Christmas, he was examining a case involving an automobile versus pedestrian accident. The man had suffered extensive head injuries. During the medical examination following the accident, it was clear that the person had severe cranial trauma and brain damage. The man also had $10,000 in cash in his jean pockets. According to police, he had a prior record, so the theory was either involvement in illegal activity or an accident. Story 11. Just sharing some stories I saved. I read them 2 years ago and they just stuck in my head. She was talking about an anorexic girl. I posted before about wanting to do her autopsy. It's my job, I'm not creepy. Finally did one on someone who was even thinner last week. Their spinal column stuck out through their stomach while lying on their back. This person had been like that for 7 years. All organs were black and green, and the skull was yellow and extremely thin. The organs were tiny and rested on either side of the spine with nothing on the spinal column. The thyroid bone was fully visible through the neck skin. The muscles that sit over the skull were basically non-existent. The brain was mushy, as were the lungs. Their liver was half the size of a normal liver. The intestines were mostly dead and fell apart to the touch. Cause of death was liver failure, with etiology for aspiration pneumonia. This person also had a small brain. The brain normally sits packed into the skull with the dura tightly encasing it. In this case, the brain was not flush with the dura, with clear gyri that resembled gelatin. Fresh brains are typically pinkish and soft, like a firm creme brulee. In this case, the brain had the consistency typical of rather decomposed brains or people found days later in water. Stomach acid was found throughout the small intestine, lungs, and ascending bowel. Despite severe starvation, there was a significant amount of fecal matter, bright yellow in the small bowel, which I had never seen before. All organs were abnormally sized, such as the spleen being the same size as the kidneys. The lungs were situated lower than normal, leaving a 12-centimeter space above them when the rib plate was removed. Fat people tend to have large amounts of liquid fat in the cavities, but this person was extremely emaciated. Story 12. I have a few thousand hours of cadaver dissection under my belt, and anatomical abnormalities are my absolute favorite to stumble upon during the course of a dissection. We all have a general plan with our bodies that most of us follow, but there are variations that will never have any positive or negative impact that you will never know about, and somebody like me stumbles upon it after the fact. There are a lot of documented variations in texts like Gray's Anatomy, but sometimes you'll stumble upon things that you can't really identify or aren't really too well documented. Some people will have extra muscles in their arms, legs, or hands. I'm not talking about things like plantaris or palmaris longus, but extra muscles that are completely unique, with no documented names that I could find. It's always really odd. Sometimes people will have congenital abnormalities and be missing a muscle, artery, nerve, etc. One person, their vertebral artery came directly off of the aorta on the right, I believe, going by memory, as opposed to the subclavian, which is the normal occurrence. Now, the really odd part about this was that the left vertebral artery terminated at the posterior inferior cerebellar artery, so the basilar artery contribution was only from the right vertebral artery. Their circle of Willis had an incomplete contribution, but I don't know anything about the people when they are alive, so I don't know if they had any cognitive or neurological deficits. Story 13. Combining the facts and my own assumptions, I would say it was a rapidly progressing colorectal cancer of some kind, possibly related to underlying Lynch syndrome, that metastasized to the liver, the lymph nodes, the peritoneum, etc. This was a forensic, as opposed to clinical, autopsy, so some of the techniques that could have been used to construct a more precise narrative of what had occurred in regards to his cancer, which was not the cause of his death, was beyond the scope of that procedure, but durable tissue samples were taken to make pursuing that option available to the family. I really don't have an explanation for it. There are rare causes of reduced pain sensitivity, many of which wouldn't be a possible explanation in this instance, but some of which might. Toxicology was positive for painkillers, but in such a way that suggested a more isolated exposure as opposed to chronic use. But there are limits on what can be known for sure there. It's possible that a sedentary lifestyle combined with adherence to the kind of low-protein, low-sodium, no-alcohol diet that a doctor might recommend to someone with, say, liver failure, combined with occasional use of painkillers, did somehow in conjunction mask his symptoms. It's also possible that he was doing something, I don't know what, just something, which he believed to be damaging enough to the body that he felt it explained his symptoms, and for whatever reason, didn't consider the pain, the vomiting, the fatigue, the blood in his stool, or whatever else undesirable or cause for concern. Maybe he had tried some strong painkillers or other substances and had been under the mistaken impression that that exposure was somehow sufficient to explain subsequent problems, and he was too embarrassed or afraid to tell anyone. It's also possible that somehow he knew what his situation was and there is just no record of it, and he didn't pursue treatment or tell anyone or drop out of school. Story 14. Yay, it's a distinct smell. What's sad is when you can start to tell the state of decomposition because of the subtle changes in the smell. We had one that involved a male who had an MI while alone in his hot tub x 14 days. Anchorage. I didn't get to stick around to find out how they removed him, as it was nothing more than a giant human stew. It's funny how things become so normally routine when you are around it all of the time, but to the people around you, so unthinkable. What they probably did was try their best to drain the tub, human stock, wrap him in towels or any clothes that might be nearby and pull them out, trying to keep them all in one piece. And you're right about the way it all just becomes another day at the office. The tub was about 104, if I remember right. Portions of the skin and muscles had started to pull away from the bone, like around the joints and the face. I still think it was cool as shit to see this, as bad as that sounds. I know that feeling well. Schadenfreude and guilt make for a heady combination. Story 15. Yes, but only when they are moved. Pressure on the bowels will cause the gas to shift and it only has one way to go. I actually got mess on by a decomp that was about 6 feet away from me because the force of the gas coming out of the anal sphincter propelled the nugget across the room when a coworker rolled a body onto its side. At the time? No, I was so angry I was just swearing and stomping and cursing while my 3 coworkers were laughing so much and rolling on the group laughing. Immediately afterwards, once I had cleaned off? Absolutely. You had to develop a sense of humor about the absurd mess you dealt with, because some things are just funny, and you really latch onto those moments, because it helps balance out a lot of the misery you experience. No, only on the leg, fortunately. However, it was always a shock when a saw would send a spray of blood across your mask. Story 16. Obligatory. I am not a medical examiner, but I had witnessed/assisted in some for my degree program. This is the story of who I like to call the Maggot Man. When I was going through my forensic science program at my university, it was required I took an Intro to Crime Scene Photography course. One of the requirements for this course was to visit the office of the chief medical examiner for a day and take photographs of the cadavers that were in for the day. The day that my professor, a few classmates, and I went, we were debriefed prior to entering the room that there were 6 bodies. We had an overdose, a motorcycle accident, a presumed heart attack, a car accident, and a woman who had passed in her sleep. I noticed that those were only 5 people, so I raised my hand and asked about the 6. The lead pathologist explained that the last body was in a quarantined room separate from the others. This room could only be entered in full hazmat gear. So we, the students, weren't allowed to enter. I didn't want to continue to be a bother, so I refrained from asking any more questions about the cadaver. Luckily, the CS photographer that worked at the office picked up on the morbid curiosity of me and my fellow classmates, so he whispered to us that he would tell us about it once the debrief was over. We stepped outside and went into his office, and this is the story. The body was of a man that had been reported to drop dead outside of a club entrance the night before. It was a Friday night, so the club was roaring with people, and the police arrived moments after they were called. No one had understood what happened, the attempted CPR and whatever other protocol to breathe life back into this man, but he was dead on the spot. Keep in mind, nothing looked off about this guy. He was a handsome black man, dressed in a luxurious name-brand suit, and seemed very well kept. A few witnesses were asked questions, and the only person that seemed to know him was a woman who had explained she had been dancing with him throughout the night. They brought his body into the OCME. Due to the suspicious circumstances of his death, no one had claimed they knew him. His blood was sampled, and no drugs were found on or in him. There were no wounds on him or signs of injury, no blood, nothing. So they began to remove the suit this man was wearing, at first starting with the top. Once again, no signs of injury, and he was wearing a very nice cologne. It was once they removed his trousers that the cologne was quickly overpowered by a scent that could only be described as rotten meat and decaying flesh. The genital area was severely decomposed with maggot infestation, causing fatal internal bleeding. The body had to be transferred to quarantine. The thought of anyone accidentally touching the decomposed area is nauseating. TL Dr. Well-off man drops dead outside of a club. No one knows why, so he's taken to the OCME. After an external examination, they remove his trousers and underwear, only to find the genital area severely decomposed with maggot infestation, which had eaten through his femoral artery, causing his death. Story 17. I met a medical examiner at a friend's party recently, and he told us that once he received the body of a cheese factory worker who fell and drowned/burned in molten cheese. It was super awkward as the corpse they received was embedded in a chunk of cheese as it had cooled down. Felt like carving out a corpse from the leftovers of a fondue French molten cheese dish. It was his top one. Story 18. My dad used to perform autopsies. His best story was that they were brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied, and the body cavity is filled with lead shot. Story 19. The death of Sean Doyle in 2002. He was fighting with a friend on their way home after a night out and got pushed down an open manhole. He was basically steamed alive. The coroner that did his autopsy did an interview years later and said it was the most horrific autopsy she'd ever done. Story 20. I was a forensic tech for a state medical examiner's office for about 2 years. I've assisted in about 1,000 autopsies and have removed bodies from scenes from likely twice that. The disturbing one was a mom that had drank herself to death, according to the husband, after relapsing on Mother's Day weekend. I just felt like something was off. Sent her for an autopsy. Had a ruptured liver where dude had essentially beat her till she internally bled to death. Later, while out on bail, he stole a semi-truck, crashed it in a pond, got out shooting at a deputy, and they killed him. Saved the taxpayers a good chunk of money. Story 21. I worked as an anatomical pathology technician. Basically, my job is to carry out the external examination of a patient and then eviscerate them, ready for the pathologist to dissect the organs and determine a cause of death. When I was a trainee, it was a sort of rite of passage for you to eviscerate the decomposed bodies. I always used to make my first incision and then leave the body to gas off, which literally made your eyes burn. It smelt that bad, but ultimately when it came to eviscerating the body itself, it seemed to make it not smell as bad once the gases had all been expelled. Maggoty bodies are generally the worst because the maggots literally get everywhere. Dozens of times I could feel them crawling up my sleeves and inside my scrubs. As you can imagine, you see some really disturbing stuff in the profession, but one that will always stick with me is a 13-year-old girl I had to autopsy, who had jumped from a bridge due to online bullying, and had been in the water for about 3 weeks. I remember her coming in, being partly skeletal, sopping wet and covered in mud. I couldn't help but feel an overwhelming sadness as I looked at her, because of how young she was, and that she had taken her own life due to bullying. I will never forget looking at the few strands of long brown hair that were left on the remaining parts of her scalp. Anyways, before we could carry out the autopsy, she needed to be undressed. Her jeans were full of sand and mud, so I had to carefully cut these off of her and hose her down as I went along. As I was pulling off her jeans, some of the lower leg tissue was still delicate and moving slightly, which was overwhelming for me in that moment. Story 22. I'm going to use my throwaway for this. I work as an RN in labor and delivery at a high-risk center, so we often get very difficult cases. Unfortunately, fetal demises aren't too rare, usually from congenital abnormalities or spontaneous abortions. Having worked in the past with adults who have died, working with deceased babies is much more emotionally challenging than I had expected. 2 stories stick out in my mind the most. My first fetal demise was an induction for an 18-week-old fetus. Fresh out of school and loving working with healthy babies, this assignment terrified me. The mother delivered the baby completely intact, in the amniotic sac. With the mother and father sobbing, I carefully handled the sack, placing it on a blanket and preparing to examine it. I stood there trying to remain professional but was completely frozen with fear. My preceptor said, "If you're okay, go ahead and open the bag, take the baby out, wrap them up, and hand it over to Mom." I carefully opened the bag, holding my breath. At 18 weeks, the skin was fragile and very delicate. I was especially careful to be gentle and respectful for the parents. I cleaned up, gave the family some alone time, and stepped out of the room, deeply moved. The second story happened once I felt a little more comfortable in these situations. This baby was around 18 to 19 weeks, delivered due to anencephaly. It was my job to take photos, footprints, and create a memory box for the family. I carefully dressed the baby and tried to get as good pictures as possible. The baby was extremely fragile, and the skull was underdeveloped due to the condition. While adjusting for a photo, the head slipped from my hand, and I carefully repositioned it without further handling to avoid distressing the parents. I managed to take a few photos while ensuring the baby was treated with respect and the parents were spared additional distress. Story 23. Forensic pathologist here. Two come to mind. I had just moved back to my home state where family lives. Get a case with a man with a distinctive last name in the family tree. I put a text out to my mom to see if we were related, but before she texted back, I pulled the sheet back and already knew. He looked like me. It was my great uncle. Get a case where it's a house fire death. On exam, he's got multiple, textbook stab and incised wounds. I spend the next 30 minutes getting gaslighted quizzed by PD about, "Are you sure?" because they thought this was a straightforward house fire. Unfun fact, fire's not an uncommon way for people to try to conceal a homicide. Story 24. I was a forensic tech for a state medical examiner's office for about 2 years. I've assisted in about 1,000 autopsies and have removed bodies from scenes from likely twice that. I told these stories in another Ask Reddit thread about people who clean up crime scenes, and I have a few takeaways. Man who had a severe psychotic break and inflicted fatal self-injury. Man who suffered a fatal assault involving objects. Man who died by hanging using a high-tension cable. Woman overdosing whilst carrying an 8-month pregnancy. No really any major revelations like, in terms of something wild, unexpected, or a medical finding that contradicts the police report. Just seen enough in one lifetime for 100 people. Edit. You can likely dig through my posts if you want to find the whole stories. Pretty sure my profile is public. Story 25. I may be late to the party, but I finally have a good story to tell. In medical school, my group's cadaver was an 80-plus-year-old female who was extremely unfit, morbidly obese with muscles half the size of any other cadavers. Her pectoral muscles were paper-thin, to get some reference. We figured she was bedridden during her last few months, which would somewhat explain these findings. When we started our neurology unit and began to dissect the infratemporal fossa, I discovered a small metal pellet under the skin behind her right ear. My tank mates and I went on to find dozens of these metal pellets strewn around her head's anatomy, with some lodged into the cranium and others in the bones of her face. We contacted her living relatives to get some clarification, and they ended up revealing that when this lady and her brother were children, they said she was 8 years old, they were playing with an old decorative rifle that the family had mounted above the fireplace. Long story short, the brother accidentally discharged the rifle into the girl's face. The aftermath was this lady was blind and wheelchair-bound for the rest of her life, and the pellets weren't all removed. It was an interested dissection with that information from then on, but a sobering moment in reminding our class that our cadavers are humans, with their own struggles and rich lives. If you're considering donating your body to science, please know that we don't take the responsibility lightly, and a million thanks aren't enough. I have more stories if anyone is curious. Edit. I should add that her granddaughter made a point of saying this lady did not hold a grudge on her brother, and they lived full lives on happy terms. Story 26. Not exactly an autopsy per se, but it was a patient found unresponsive, with CPR in progress by EMS. The man was clearly homeless, based on his appearance. He reportedly had not been seen for several days by his friends, and was eventually found behind a fast food restaurant dumpster. We were briefly able to get a pulse back, and when the nurse cut his pants off to place a catheter, we saw the cause. He had fashioned a makeshift ring around the genital area, which severely restricted circulation, causing necrosis. I did a bedside ultrasound and found his abdomen full of free fluid, which is bad. Most likely his bladder had ruptured from being unable to urinate for days. His lab suggested he was in septic shock and full-blown renal failure as well. He did not survive much longer than that. Edit. I remembered another one. In my final year of training, we had a cadaver lab to practice advanced airway management techniques, e.g., difficult intubation, cricothyroidotomy, etc. While I was helping an intern do a basic intubation, she commented the tube wouldn't pass. I think she has some kind of growth or mass in her airway. I took a look, asked for some forceps, and pulled a half-eaten hot dog out of her larynx. It, of course, had been embalmed along with the rest of her. Cause of death identified. Story 27. I've seen a few in my life, though not being the part of the ME, or coroner. In the past, I worked as a deputy, so every so often we'd have to do calls where, inevitably, we ran across deceased persons. A couple that stick in my mind as being the most bizarre responded to a house after a man's wife called to report her husband had been attacked. We arrived to find the man dead, with no pants on, in the barn. Best we could ever figure out was the man had been involved in a bizarre incident with animals, which led to severe injuries, and he bled to death. We had another that took the better part of 2 years to solve. In that case, a young boy, about 15, was found wrapped around a pine tree, wearing only his boxers. By wrapped around, I mean in the sense of every bone in his body broken. His friends weren't talking about what happened, and while yes, foul play was suspected, we couldn't exactly arrest on suspicions. Eventually, about 2 years later, after one of his buddies had been picked up on a somewhat minor trespassing charge, he came clean. Apparently, the boys had this game they would play where they would get drunk, then catch one of the passing freight trains. As the train neared the usual swimming hole, the boys would jump off the train down into the water. Supposedly, when the train neared the usual bridge, the boy in question mistimed his jump and ended up wrapping himself around the tree. The other boys were just too scared to admit they had been involved. One that was never solved involved a set of remains that were found inside an old brick smokestack during the stack's demolition. What gets weird about it was the man had apparently died of starvation, so that ruled out him having fallen inside the stack. There wasn't a ladder on the outside of the stack, nor a door to access that area. The smokestack was tied to an old school and had last been used sometime in the mid-1950s. The remains were dressed in clothing typical of the 1970s, which just made things even stranger. We identified the body as being a young man who had gone missing sometime in 1974, though beyond that the trail went cold. Never figured out how he had gotten himself in there in the first place. Story 28. Former biological anthropologist. As an undergrad, I worked for a forensic anthropologist. This is the weirdest case she had that I got to see for myself. It was from the 1920s. My boss had inherited a coroner's collection of odd/interesting bones he collected during his tenure in a major city. Back then, coroners could just take whatever they wanted from bodies without telling the families. If the individual was poor/indigent/an immigrant/a minority, they really helped themselves, sometimes taking the whole body. This coroner took a lot of stuff, even re-articulating some of the pieces, reconstructing how they looked when they were attached to the rest of the person. So anyway, she has this collection she inherited, and several of the pieces are designated what she calls death by testosterone poisoning. They did not literally die of testosterone poisoning, but they all died because of risky, stupid, ridiculous actions. Think jackass, only with no monetary payout. The weirdest one was from early last century, a white man in his 40s who died from sepsis from multiple arm fractures that he got in an arm wrestling contest. Why multiple fractures? Because even after cracking his humerus, upper arm bone a bit, he couldn't bear losing, so he just wrapped it up with some kind of splint, had some guy hold the fracture, just a crack at that point, and went for best 2 out of 3, whereupon he snapped the humerus all the way through and broke his radius and ulna when he slammed his arm down on the edge of the table in anger. The preserved bones came with the whole story recounted in the coroner's notes. One of the lower arm bones, radius or ulna, I can't remember which, protruded through the skin, and being too cheap/too stupid to see a doctor, the wound became gangrenous, and the infection entered his bloodstream. He died of septicemia a few weeks later. Looking at the bone, I could see all of the fractures, as well as where the infection had attacked the periosteum and the bone itself, with no sign of healing.